Today we're going to talk about Medicare, Part A, B, C, D, all the rest of it. And you probably heard out there it's mandatory, mandatory. You have to get it at 65 years old, or you have to get it if you've been on disability for 2 years. Well, yes and no. As with anything, the Social Security Administration, I guess, in anything with the government, there's exceptions to the exceptions, the exceptions. And I'm going to talk about that today. If you're new to my channel, my name is Ed Weir. I ran the third business Social Security office in the country. In my semi retirement, my mission is to get you everything from Social Security and Medicare you earned and to also make sure it's around here for you in the future. All right. So I'm going to talk about all things Medicare here and signing up for Medicare and all the different the letters. It should take about not that long, about 10, 15 minutes. And then it looks like I already got a bunch of questions. This is also a live Q&A, so I'll answer questions for about 40 or 50 minutes after that. All right, let's get right into it. Make sure you subscribe and like and all that kind of good stuff to teach this these algorithms that this is important stuff that people need to get out there. All right, so Medicare Part A. It is a zero premium. Nobody should say Medicare this, that, or the other is free. Medicare Part A is zero premium, but you paid for it out of your FICA taxes for decades and decades and decades. So when you pay your FICA includes your Social Security tax, you pay 6.2%, your Medicare 1.45%, and then your employer pays the other part. So it's zero premium once you sign up for it, but you did pay for it. Is it mandatory? Yes and no, depending on your particular situation. All right. So if you are approaching 65, this is the big one that everybody thinks it's mandatory at 65. Yes, possibly, unless you have health insurance from work. So here's the when you turn 65 and you don't want to start your monthly benefits, your Social Security monthly benefits, you basically don't have to do anything. You're not receiving benefits. You don't want Medicare. Is it mandatory? No. If you have health insurance from work, current work, yours or your spouse's, it has to be current work. It's not the Affordable Care Act, Marketplace, Obamacare, um, whatever you want to call it. It's not a COBRA. It's not a retirement health insurance plan. It's from current work, yours or your spouse's current work, and your group health plan has 20 or more employees. If that is the case, you do not have to sign up for Part A. You do not have to sign up for Part B or Part C or Part D or any of it. Obviously you have to be happy with your health insurance you get from current work. Sometimes people say, well, yeah, I've got health insurance from current work. I don't have to sign up, but the health insurance from work is terrible. And Part A, Part B with a supplement or something that's a lot better and cheaper. And so they do go that route. But it is not mandatory if you have health insurance from current work. And another exception, some people do pay for Part A. If you did not pay into Social Security enough, 10 years, the 40 quarters, you have to pay for Part B. It's pretty expensive, over $400. So you have to pay for Part A if you're not insured. If you are not insured on your own record, that is, you never paid, but you were married to someone that did pay into the system, then you can go ahead and sign up for Part A and Part B on their record. So you don't have to be, insured on your own. So, but if you are receiving monthly benefits, what will happen is about 3 months before you turn 65, Social Security will go ahead and sign you up for Part A and Part B automatically. They will send you your card about 100 days before you hit your 65th birthday or your 24th month if you're on disability. Be very careful when you're 65. Every health insurance, everybody, company, and everybody in the country knows you're turning 65, and you're going to get tons of calls, even more than usual nowadays, and you're going to get a bunch of emails and a bunch of mail. And what I see happening is people, some of these companies make it look like official mail coming from original for Medicare or something, which they shouldn't be doing, and you just throw away your actual packet from Medicare. So I get to hear a lot of people saying, "Yeah, I really need to sign up for Medicare," and they're like 66. I'm like, "Well, you've had it for a year." So, no, I never got the card. Yeah, you did get the card, but maybe it wasn't delivered or you threw it away or whatever the case may be. So it's important when you turn 65, if you're currently receiving Social Security benefits, however, if you have health insurance from current work, yours or your spouse's, 20 or more employees, the whole regular thing, you can refuse Part B because next year in 2025, Part B is going to be $185 for most people. And guess what? There's an exception. So for most people, it's going to be $185 for Part B. And if you have health insurance from current work, you why waste the $185? I see too many people wasting that $185. Return the card. They'll give you instructions. They change the instructions on how to refuse Part B every now and then. They try to make it easier. Sometimes it gets more difficult, but you can refuse Part B. You cannot refuse Part A if you are currently receiving Social Security benefits. Guess what? There's an exception. That is if your Part A is free. If you have to pay for your Part A because you're not insured for Social Security, then you can refuse Part A. Exceptions, the exceptions, exceptions. Here's one of the exceptions about $185. $185 for Part B for most people, unless you're a high income wage earner based on your earnings from 2 years ago. It's called the Income Related Monthly Adjustment Amount, IRMA. It's the government. They got to have a long acronym for everything, right? So if you have a high income from 2 years ago, you're going to be paying more, $60, $100, $200, $300, whatever the case may be, depending on how much you made 2 years ago. So you'll get the letter in the mail that says, hey, you're going to be paying extra for Part B. And guess what? Extra for Part D, the prescription drug plan. And if you disagree with that determination, you can ask for an appeal. It is an SSA 44. It's a life-changing event. Like, for instance, you were working 2 years ago and sure you were making a high income, but you have since stopped working, then that's a life-changing event. So you can get that reduced. One of the exceptions they didn't make that people are always not very happy about is the fact that if you sold a house a couple of years ago and got those capital gains, that will increase your Part B premium. But it's only for 1 year. It's only for 1 year. So if you make a lot of money a couple of years ago, your Part B premium, your Part D premium will be higher, only for 1 year, unless you make more money the next year. So the exceptions, exceptions, exceptions. And if you need help on any of that, going through the entire system, you can reach out to my partners at Medicare, at Chapter Medicare. They're kind of crazy right now with the season. Speaking of that, there is right now we're in the annual enrollment period. It's between October 15th and December 7th, and a lot of people are putting comments in the comments down there. They're saying, "What's this December 7th? Do I have to do anything? Do I have to do anything?" If you have Medicare Part A and Part B and a Medicare supplement plan, one of those N or G or F, you really don't have to do anything. If you're happy with it, and you might want to check if you can get into a cheaper N or G or F, or switch from a G to an N or F to an N or whatever the case may be, you can do that 365 days of the year. Um, but if you have a Medicare Advantage plan or a Part D prescription drug plan, you really need to check it. So you go out, you can do that through Medicare.gov. You can find, an agent that you know and trust. I prefer a broker, one that works for a lot of different companies so they can shop for you, or you can reach out to Chapter and they can help you there. But that deadline ends December 7th. So people that want to find a better Medicare Advantage plan or better Part D plan, then they have till December 7th. Even if you've already changed it, like you changed it a few weeks ago and you're like, oh, second thoughts, maybe I shouldn't have done that. You can change it again. Whichever one you do at December 7th, that's the one that takes effect January 1st. All right. So current work, you don't have to sign up for Part A and Part B. Some people call me all the time and come into live Q&A and say, well, what about, I'm living overseas. I'm never coming back to the United States. Do I have to sign up for Part A and Part B? Well, if you're getting money, yes, Part A is automatic. You can't refuse that unless obviously you're paying for it. But there's less than 1% of people pay for Part A. But Part B, yes, you can refuse it, but I would caution you to really think about that decision, because you live overseas, and if you've some people, if born overseas and they come to the United States and work for 20 or 30 years and they go back, and so they're good. But I see a lot of people moving overseas, and they love it for about a year or two, and then they come back. But if you cancel your Part B, then if you don't have it when you're supposed to, you're going to get penalized. So that's where the kind of mandatory thing comes in, is that if you don't get Part B when you're supposed to, you're penalized 10% for every 12 months you did not have it. So if you were supposed to sign up for 65 and you didn't have an exception, current work or anything, and you signed, you waited till you're 70, then that's 5 years of penalty, 50%. So whatever the premium is that time, if it's $200, then 50% of that, $100. So you'll be paying $300 a month for Part B. So really, make sure you don't miss these deadlines, but also just as important, make sure you're not paying for something you don't need, right? And again, all this also counts for Part D, the prescription drug plan. You're supposed to sign up for that the same time you sign up for Medicare Part B. If you don't, then you're going to get penalized for that one too. It's basically 1%. They do this weird calculation of the average premium throughout the country. So 1% of that every month you did not have Part D. And what I see a lot of people losing money on and make mistakes is they sign up for a Medicare supplement plan, one of the N or G or F or whatever the case may be, and they don't sign up for a prescription drug plan. And whoever is helping you sign up should tell you, okay, I helped you sign up for Plan G. Now let's find you a prescription drug plan. And quite often, people are saying, "Oh, I don't take drugs. I don't need one." And the agent who isn't doing a very good job says, "Okay, bye," because they don't make money really on enrolling you in Part D. Um, so they don't care. And then 2, 3, 4 years later, you get a prescription, and then you find out you have a penalty for the rest of your life. So if you get a Medicare supplement plan, you have to get a Part D plan. If you sign up for a Medicare Advantage plan, most of those have Part D, the drug plans, bundled in them. Some don't, but most of them definitely do. If you're going to go ahead and sign up at 65 or 68 or 69 or whatever the case may be, um, depending on work and everything, once you do, then you have to figure out, what you're going to do to cover all the gaps, because Medicare Part A and Part B are great, not perfect, but pretty darn good. But there's a lot of gaps. The big one is in Part B, a 20% coinsurance. So if you get $100,000 Band-Aid from the doctor, you have to pay $20,000 out of your pocket. So people get a Medicare supplement plan or a Medicare Advantage. If you watch my channel, I always say start with a Medicare supplement plan. Contact, Medicare or your agent, your broker, relative, who does Medicare insurance plans or whatever, or contact Chapter there and say, "Hey, talk to me about the difference between Medicare supplement N and G." And if those are good for you, you pick one of those. And then you say, "Okay, well, those are not for me. What's next?" And they'll talk to you about Medicare Advantage plans. So N as at my top of my list, then very, very close behind is G. If those are not for you, then go down to a Medicare Advantage plan. All right. So what if you don't have to sign up for it in your particular case at 65, 66? It's not mandatory because you have health insurance from current work. What do you do when you don't have health insurance? So when you're 70, 75, 80 years old, once you stop receiving health insurance from current work, you have 8 months to go ahead and sign up for Part B and Part D, and there's no penalty. I always tell people, don't wait 8 months, because when you don't have health insurance for 8 months, you know what happens, right? That's when you actually get sick or fall or whatever the case may be. So you once you know you're going to lose your health insurance, about a month or two before, go ahead and get signed up for, Part A, Part B, and then find yourself a Medicare plan, Medicare supplement, Medicare Advantage plan, or whatever the case may be. And that way your health insurance from work or your spouse's work ends at the end of the month, and the new one starts the next day. Uh, and then you'll need a couple of forms. That's the CMS 40B and the 564. And the 564 is what you take down to your employer, and your employer confirms, yeah, this person has had health insurance from work since they turned 65, so don't penalize them. So what's the 7-month period there? The 7-month is if you're going to go ahead and sign up at 65. You have 3 months before you turn 65, the month you turn 65, and 3 months after. And that's called your initial enrollment period. I know It's just all crazy. There's initial enrollment period and special enrollment period in October 15th to December 7th. And it's crazy. It's crazy. That's why I've made all these videos trying to explain all the details and why I've found a chapter to help you navigate the entire Medicare system. Please don't, if you have Social Security questions, they can't help you with Social Security. If you call them and you say, I need help with Social Security, then it'll tell you to come back to me because there's too many people out there that, you know, don't know Social Security that are providing Social Security questions. A lot of people on social media, so they're giving a lot of wrong answers, and people are making bad decisions because of it. All right, so let's see here. Let's go ahead and jump into any questions you have here. Um, so, Bonnie, Charles helped me and was very patient. They are great. Try chat. Okay, perfect. Thank you very much. Awesome. Do you have to be using a Medicare Advantage plan? Um, No, that's not even mandatory. If you go ahead and sign up for Part A and Part B, you don't really have to have a Medicare supplement plan or a Medicare Advantage plan. You don't have to. I definitely would recommend getting one of those unless you've got, a couple of $1 million stuck under your mattress someplace to cover all those gaps. But yes, I would highly recommend getting some type of other coverage there. Not necessarily Medicare Advantage, but if Medicare Advantage is, again, nobody can tell you this is the best thing. There is no best thing. If I was the dictator for a day, uh, I would redesign the entire system, but that's not going to happen. So until it does, check out Medicare supplements first, and then go Medicare Advantage. And then when you do a Medicare Advantage plan, what you need to do is check to make sure whatever plan you choose has the doctors, as many of the doctors you can get, saves you the most money for prescriptions. um, is the cheapest in terms of coverage for like a day in the hospital, for a CT scan or MRI or whatever, and then start looking all for all the bells and whistles about gym membership and those grocery cards. And yes, those grocery cards do exist. Those over the counter, flex cards, grocery cards, food cards, those are tied to Medicare Advantage plans. But the way they advertise them is kind of scammy. They do exist, but they're advertised incorrectly, if you ask me. And I guess if you ask Medicare, they're trying to clamp down on those. Basically, what they do is some health insurance person company, they find the best one of those in the country in one little small place in southwestern Idaho, and then they advertise it to the entire country when it's only available in southwestern Idaho. And then people from all over the country call and say, "Yeah, I want that, $10,000 a month grocery card with free ice cream and unicorns." And they say, "Oh yeah, you don't live in Southwest Idaho. Sorry, sorry." But then they got you on the phone and they do the hard sell, and so then one day you wake up and you're in something that you don't want. And so yeah, but they do exist, but it really depends on your particular area and what particular type of plan you're eligible for. So if you need help, reach out to your insurance broker, agent, or you can reach out to Chapter, and they'd be more than happy to help you out. I had my appointment with Social Security, and I got my spousal benefits, including back pay. All right, good deal. So we're finding money left and right here. I'm gonna have to come up with one of those thermometers. Remember the old Jerry Lewis, telethon that showed the goals. I think we probably found hundreds of millions of lifetime benefits for people, spouse benefits, independently entitled device benefits, retirement disability benefits. So yeah, we're kicking it pretty well. So if spouse gets 2,000 off of my record and I get 4,000, what does she get if I die? Um, so she's getting 50%, and your full benefit is 4,000. So 4,000, that's pretty darn good. That's, not this year, probably next year, the highest benefit. So if you pass away and she is her full retirement age at that time, then she'll get $4,000. Yep. So she'll get 100% of your benefit amount minus her own. What'll happen is she'll continue to get her $2,000, and then she'll get the difference between the two. So she'll get 2,000 from her own Social Security work record plus the difference of the 4,000. So she'll get another 2,000 from you. And this was one of the worst parts of working at Social Security is when I took survivors claims, and I've taken hundreds of thousands of survivors claims, and some people thought they got their deceased spouse's benefit, and they do, minus their own. So people would come in and say, okay, one spouse is getting 4,000, the other is getting 2,000, so we got $6,000 coming to the house. So when my husband or wife passes away, that 6,000 will continue because I'll get their check. No, it'll be offset. So basically, one day you're getting 6,000, and the next day or the next month you're going to only be getting $4,000 coming in. And I've had to break the news to a lot of surviving spouses, and yeah, it was devastating financially. I mean, they just lost their loved one, and now they're going to be losing money. So make sure we need to make sure the information gets out there. Can we recover to normal if Medicare becomes Part C only for 4 years? So Part C, yeah, Medicare Part C are those Medicare Advantage plans. I hate calling them Medicare Part C because they sound like they're official parts of Medicare. They're Medicare Advantage. Those are private companies, just like Part D. Part D are run by private companies too. So anyway, I'd redesign the whole system. But anyway, Dr. Oz, call me. But Dr. Oz, he is in favor of Medicare Advantage for all. So we shall see. I'm going to keep you all up to date. I'm going to watch all this, and if I see anything happen, I'll make a video of it. So make sure you subscribe and like and all that kind of good stuff. So can we recover normal if Medicare becomes Part C only for 4 years? So you are in a Medicare Advantage plan and you want to go back to original Medicare and get a Medicare supplement. It really depends on your particular situation, what state you are in. Different states have different laws, regulations in terms of switching. So I would definitely reach out. Reach out to Chapter, and they can find out if you are able to do this. So glad to catch this. Yeah, I get a lot of people that says comments. Oh my gosh, I missed it again. I missed the live again. I did like a 3-hour special on Thanksgiving, and yeah, so glad you finally made it. I retired from federal service FERS at 56. I'm 59 now. I received a pension from OPM and I get SSDI. What do I do when I turn 62? Because a large portion of my pension will be cut. Yeah, you'll lose the annuity supplement, right? So yeah, in terms of Social Security, the reason you lose that annuity supplement, which is half of your reduced Social Security benefit, is because you can start your Social Security benefit at 62, but you're already receiving Social Security, so you don't have to do anything. The only thing you have to do at 62 is, because you're already getting SSDI, you don't want to switch to retirement unless you want to get a 30% cut. The only thing you should do at 62 is see if you're entitled to any spouse benefits. Are you currently married? Were you married to anybody for 10 years or longer? Were you married to anybody that passed away? See if you're entitled to any spouse benefits based on your amount you're receiving and based on amount they were receiving. Let's see here. So it's got a tax question. I don't answer tax question because anyway. Let's see. Social Security told me I had to take Part A when I got the packet. Yes, if you're currently receiving Social Security benefits, the monthly benefits, yes, you have to take Part A when you turn 65. Yes, but it's if they're making you take it and they're making you sign up, that means you are insured for Social Security and Medicare, and therefore your Part A is free. And the reason some people take Part A, even though they're working and have health insurance from work, is because maybe their plan at work is good, but it's not great. So if your plan at work, let's say it has a 6,000, or let's say it has a $3,000 deductible. Um, if you go in the hospital, you have to pay the first $3,000. Part A covers hospitals, and this year it has a $1,632 deductible. So you pay the first if you sign up for Part A and you go to the hospital, you pay the first $1,632 and you're good. If you don't have Part A, then you have to, whatever your health insurance company says, you have to pay the first $3,000. So that's why some people signed up for Part A. But it's crazy. The issue there is, if you sign up for Part A and you're giving to contributing to a health savings account, you have to stop contributing to that health savings account 6 months before you start Part A. You can still, take distributions from the HSA, but you can no longer contribute. So Charles at Chapters Broker, he solved my Medicare Advantage. Quite pleased so far. Awesome, awesome, good deal. I was approved for SSDI with retro pay. So SSDI is Social Security Disability Insurance. Age 47, condition stage 4. I was awarded Medicare Part A and Part B. How would add dental and eye coverage? Um, you can add a Medicare Advantage. A lot of the Medicare Advantage plans have dental, vision, hearing. Um, you can, in some states, you're able to get a Medicare supplement plan. As you know, I always recommend Medicare supplement plans first. But if you are receiving Medicare because of a disability, that means you're probably under 65 years old, or you are, in your case, 47. So, probably in your state, you're not even able to get a Medicare supplement plan because your state regulators don't mandate those companies to provide it to you. So, the only thing you could probably get is a Medicare Advantage plan. But again, it depends on your particular state. And sometimes they said your state regulator says yes, fingerprinting gurus. Give him or him or her a Medicare supplement plan, and then they say okay, but they'll charge you like 3 or 4 times what everybody else has to pay. So a Medicare Advantage plan, most of those have dental, vision, and hearing in there. And the trick is when you do turn 65, then you can get a Medicare supplement plan, Energy or whatever. And there's no more health underwriting or anything like that. And they can't charge you anymore. So if you're on disability, those are the things. When you're 60, check to see if you're entitled to any survivor benefits. When you're 62, check to see if you're entitled to any spouse or divorced spouse benefits. When you're 65, check to see if you should have gone with a Medicare supplement. And then once you hit your full retirement age, you're no longer on disability. You're on regular retirement benefits. So there's no more work limitations. So, does it hurt to just go ahead and take Part A, even if you got good health insurance through your work? Right. So, yep, I knew you were going to ask that. That's why I just answered it. So, yeah, it's better in the deductible, possibly. So, check your health. Call your group health plan and say, hey, if I go in the hospital, how much is my deductible? And if they say, $3,000 or anything over, $1,700, then yeah, might go ahead and just sign up for Part A. Let's see. I was married to someone for 20 years, and he was in the Coast Guard during our marriage. He's remarried, but I wondered if I would be able to collect anything from his time in there. Well, not necessarily from the Coast Guard, but from Social Security. If you were married and, yeah, for at least 10 years, you got 20, so you're good there. Um, if you have to be 62 years old, and you have to file for benefits on your own record first. It sounds like he is still out there. Um, so you file for benefits on your own record first, at earliest at 62, and then if his benefit amount was twice your benefit amount, then you can get the difference between those two, even if he hasn't filed for benefits. So it's called independently entitled divorce spouse benefits. So please, everybody, press like and subscribe and all that kind of good stuff because there's so many people out there missing these benefits. There's so many people out there that are sitting around waiting for their ex spouses to file for benefits because they think their ex has to file benefits for them to get benefits. That's not correct. That person has to be at least 62 and you have to be divorced for 2 years. And then you can get benefits on that person's record again, but that person's record has to be twice your benefit amount. So, let's see, was going through a divorce but did not sign, and he passed away in July, was given 100% of his Social Security. Yeah. Even if, yeah. So even if you were married for 10 years and divorced, then you were still entitled to that as a surviving spouse. So, um, yep, you got your money. Good. So sounds like you did the right thing. I retired from OPM too, but when I turned 62, I got my Social Security. Of course, I did get penalized, but my pension wasn't enough to live off. Yeah, the penalty is just you're because you're filing early retirement. So anytime you take money from Social Security, retirement benefits, survivor benefits, spouse benefits, your benefits are reduced if you start receiving those benefits early. So yeah, you stop getting the annuity supplement from OPM, which is for those people listening, the OPM Office of Personnel Management, they're the ones that take care of federal employees. And under the new system, FERS, the Federal Employee Retirement System, if you retire early, then they give you kind of your early part. It's not really early Social Security, but they give you part of it and stuff because, the government kind of retired you early or voluntary or reduction in force or whatever. So anyway, Tony, my brother, age 58, died on 8/1. He received SSDI $3,000 a month for 25 months. At 63, does his wife qualify for survivor benefits? Can she claim survivor benefits now and defer her benefit until age 67 or even 70? So, number one, Tony, awesome on you. Thank you so much for taking care of those people around you, your brother's wife. So, good job. Thank you. Got an awesome community out there, always looking out for other people. So this is awesome. Yes, your his a survivor is entitled to survivor benefits starting at 60 years old. So yes, on a survivor claim of survivor benefits, you can make sure I still got volume here. You can receive survivor benefits and don't so she starts her survivor benefits, but she does not touch her own, and she lets her own benefits increase until 67 or 68, 69, 70. But in the meantime collects those survivor benefits, and then when her benefit amount is higher, then she jumps over onto her home. But as with anything, early retirement from Social Security, you're limited to the amount of money you can make. For 2025, that's $23,400. So if she's not working or she's working under that, then absolutely she can go ahead and collect the benefits. If she's working over that, then Social Security just holds back $1 for every $2 you go over. So, can we refuse Part B if we purchase an Advantage plan that we like? No. If you refuse Part B, you also lose the Medicare Advantage. In order to sign up for a Medicare Advantage plan or a Medicare Supplement plan, you have to have Part A and Part B. So, good question. 185 Part B is still cheaper than the lousy insurance offered at work. All right, good deal. Yeah, and then if again, check out the Medicare supplements N or G. If it's just not in your budget, then go a Medicare Advantage. And if you really want to save money, but be careful. There are plans out there called Medicare Advantage Part B Give Back. So CMS, Medicare, the government allows these companies to pay for part of your Part B. So these are really good for like veterans that predominantly use the VA medical system, because they're like, oh, why do I need Part B? And when I've got the VA medical system, because I don't want to have to pay the $185. Well, if you have one of these Medicare supplement or Medicare Advantage Part B give back plans in your area, that could plan zero premium per month. Plus, it might pay $50, $100, or all of your Part B premium. Depends on what's available in your particular area. But be careful. If you're using the VA predominantly, then that's probably a good idea. If you're not, I would recommend you have to be kind of healthy, because these health insurance companies, they don't get to be billion-dollar health insurance companies by being stupid, right? If they're going to just give you, money to pay for your Part B, $50, $100, $185, they're going to take it out of someplace else. So on a regular plan in your area, let's say if you go to the hospital, they'll charge you $100 a night on Medicare Advantage. But the same company, if they're going to pay for part of your Part B, they're going to charge you maybe $300 a night or something, or $300 for a CT scan. Or if they're not paying for it, maybe they'll charge you $50 for a CT scan. So you have to watch the fine print there. But yeah, if you're young, 65, 66, or whatever, 70, and still healthy, then yeah, you get one of those Part B plans that pay for part of your Part B. You do that for a year, save yourself a whole bunch of money, take a trip to Hawaii, and then next year you say, "Oh yeah, I'm starting to feel a little, old, weathered, and maybe I should go ahead and switch back to a regular plan in case something happens." So that's the great thing about this season every year is you have the opportunity to kind of design a plan that's good for you. There's some people out there that are doing it completely wrong. They're stubborn and they're like, well, I like my plan and I'm just going to keep it. Well, guess what? That's not your plan. You signed up for a Medicare Advantage plan or a Part D plan, 2 or 3 years ago. It's changed 2 or 3 times. Those plans are only good for 1 year. And if you don't check it, then, those health insurance companies, that's what they bank on. They hope you don't check it, because then they just might downgrade it and make more money. And actually, they're right. 70% of people do not check their plans every year like they should. So, yeah. So, and all the time, people are surprised. I thought I only had to pay $100 a night when I went to the hospital. Yeah, that was your plan 3 years ago, but it's not anymore. So, all right, let's see. I have the card. It says A and B. They will take 174 per month. How can I lower that? See, Bill, I knew you were going to ask that question, so that's why I just answered it. But yeah, this year is $174.70. Next year, it's going to be the $185. So they'll start taking that out in December. How you lower that? There's a couple of ways. The one I just talked about, the Part B give back plans, or if you're eligible, you reach out to your state Department of Social Services, Department of Welfare, Medicaid office, and you can apply for Medicaid. There's a program called the Medicare Savings Program, and you call up Medicaid and you say, hey, low income, little resources, I'm only living on, 15, 16, $1,700 a month of Social Security. I need help. And they'll check to see if you're eligible. If you're eligible, then they just might pay for your Part B. So that puts another $185 back into your pocket. And if you have upper levels of Medicaid and Medicare, you're called dual eligible. Dual, you have Medicare and Medicaid. Yes, you can have both. And then you can get one of those Medicare Advantage dual eligible plans. Those are the ones you see advertised with all the, the shiny grocery cards and stuff, because those ones usually have the best of the grocery cards, depending on your area. So yeah, if you get Medicaid, I would highly recommend you check out a Medicare Advantage dual eligible plan. There's a lot of people losing Medicaid, and maybe even more so in the future, depending on what happens in the next administration. So if you lose your Medicaid, you're probably you're going to lose your Medicare Advantage dual eligible plan. If you had a dual eligible plan and you lost Medicaid, guess what? You're no longer dual. And even some people that don't lose Medicaid, they're just downgraded to a lower level. Then you might lose your Medicare Advantage dual eligible plan. And if that happens, you can switch to a regular plan any time of the year. The whole December 7th deadline is not relevant to you. So if you receive a letter, January, July, August, or whatever, that says, hey, congratulations, you got Medicaid, check out a dual eligible plan. Hey, congratulations, no, I guess, sorry, you've lost Medicaid, then you need to switch to a regular plan. So leave it to the government to make things complicated. Yes, I agree. That's why, yeah, I'm here doing these crazy videos, and I try to make it easy, but unfortunately, sometimes there's just too much exceptions. The exceptions. Yeah. If I have insurance and get sick, can I use Medicare for hospitalization? Yes, Part A covers hospitalization, but again, there's the gaps there. There's the deductible, and that for this year, the Part A deductible is $1,632 if you go into the hospital, but that's not an annual deductible. That could be done 2, 3, 4, 5 times a year. So yeah, it's um, all right. I now wish I had stuck it out and waited to retire at 65. Yeah. Yeah, a lot of people making the wrong decision, retiring at the wrong time, starting the wrong benefits, and that's why I'm doing all these crazy videos. So, my husband passed last June, but just applied last month. Can I get his Social Security back to June? Um, it really depends. When you called, always ask for it. Always ask for back pay, retroactivity. So if Social Security dropped the ball, maybe they gave you the lump sum death payment, the $255, but they should have also taken a claim for survivor benefits. Then you call them on it, as we used to say, you call them on the carpet. And you say, hey, how come I applied back in June for that $255, and why didn't you give me my monthly benefits? And they'll, oh yeah, okay, we messed up. Or if that didn't happen, maybe you called a month or 2 months or 3 months ago, then you're protected. If you called them 4 months ago and asked them about this, and now you're just getting around, you just got an appointment or getting around to it, you can ask them, says, hey, I called you all 4 months ago. I want those 4 months of back pay. So always ask and see if they're able to give you any type of retroactivity. I know I can get 50% of my spouse's SSDI at age 67. I will be 65 in February. Is there any chance I can get it at age 65? No, you'll only get, it'll be a reduced amount because you're getting it early. Yeah. So if you get it at your full retirement, then you get the full 50%. Some Advantage plans, Part C help with paying your Part B premium. Yep. That's the Medicare Advantage Part B give back. I was born in May 1960 and I have received SSDI. And when will I be switched to regular SSI? You're not SSI. Your SSI is the welfare based program, supplemental security income. You mean just regular retirement. Yeah, it'll be at your full retirement age, 67 years old. You'll be switched from regular disability to regular retirement benefits, and the check will stay the same. And most people don't even recognize the difference. All right, let's see. Catherine, I mean, my IRMA went up to 23 taxes because of my income was raised by credit card payoffs. Was a one-time thing. My month to month really is half. Do you think I can successfully appeal this extra? I would definitely try it. SSA 44, the life changing event, and put it in there on, I don't know the details of your particular situation, raised credit card payoffs or something, but yeah, it doesn't hurt. All they can say is no, or go away or whatever. But yeah, SSA 40, but they better not say go away. But SSA 44, a life changing event, and you just put down there, yes, I made X amount of money in 2023. However, life changing event. Let's see here. I'm gonna get some other. Phil, I received Social Security disability when my spouse turned 62. Can she file for spousal benefits? And would that be at 32% of my benefit? Wow, sounds like you did your research. Yeah, about 32%, because she's filing at 62. Again, your benefit has to be twice her full benefit amount, but she has to file for benefits on her own record first. Okay. All right, let's see. I have Medicare Part B, but I'm 100% VA disabled. Am I throwing money away? Um, Good question. Um, if you have VA medical and you're 100% happy with it, some people, yeah, just go ahead and get out of the Part B. Unless, again, if they get the one Medicare Advantage Part B give back plans and they get their cake and eat it too. But if you don't have a good one available in your area, or whatever the case may be, but be careful when you disenroll from Part B if you refuse Part B. What happens when the VA, they're talking about cuts to the VA medical system next year? What happens when service deteriorates? Where are you going to go? What happens if you move and the new place you're living at doesn't have a good VA facility or a VA facility at all? So it's good to have Part B as a kind of a fallback. Um, even if you're not using it right now, because again, you're like, oh yeah, but I'm good. I know it's not going to, I know the VA is still going to be awesome in the next 5 years, but 5 years from now, if you want to go back to Part B and you've canceled it, then you're going to have to pay 50% penalty. And you can only sign up January, February, March. So you have to wait. So if you get sick in July and need to see somebody, then I'm sorry. You have to wait till January. The earliest you can sign up for B if you disenrolled like that is in January, and your health insurance starts in February. So yeah, definitely think about all the variables there. Let's see. Yeah, if you're happy with your VA care, you wouldn't have to have Part B. That is correct, but you have to make sure you're going to be happy and all the rest of the stuff. Can anyone answer this? I'm full age in 9 days and want to claim my Social Security. However, I worked all year and don't have my W 2, which will be January. I'd like to add that to my lifelong wages. Should I wait? Nope, nope. That shouldn't stop you at all. Um, because it's not going to make a difference right now, because whatever you have is kind of an estimate. So um, go ahead and file. And then next year, you file your taxes. Contact your buddies at the IRS, file your taxes. The IRS notifies Social Security how much you made this year. And then if it increased your benefits, then increases your benefits. And if it's retroactive, then they'll pay you. If they were supposed to pay you, X amount of money, you know, starting, January, February, whatever the case may be, they'll pay you that retroactive. So yeah, I, you know, I wouldn't wait for that particular reason. If you have other reasons to wait, then that's a whole different issue. I currently have Part A and B and supplement along with employer provided primary. Wow, sounds like you got a lot of health insurance. So yeah, I would definitely check that out. If you're paying money for your employer plan and paying for a Medicare supplement, N or G, do you have too much? You're paying too much. The one health insurance covers all of this, and the other health insurance covers all the same thing, and but you're paying twice. Possibly, I would definitely check that out. Maybe you might be able to save some money. So I solely use VA Care. I have Part B because I thought I had to. Again, you don't necessarily have to, but you should definitely, 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 consider all the options. All right, let's see here. Thank you for all that you are doing. I hear you say you recommend supplement N and G. If I have F, how come you don't recommend F? I do recommend, yeah, but nobody can really get F anymore. You had to be entitled to Medicare before January 1st, 2020. So people starting today going forward, 99 points for people are not eligible for Plan F. They're only eligible for Plan G or N. So all right. But if you have a plan N, F, that covers all of the six gaps. G covers five of the six gaps. But yeah, so if this was 3 years ago, I would recommend Plan F all day long. Ed, good day, Ed. Officially signed up with Chapter. Good. Kevin was awesome. All right, they took care of me. A and B. Sup G for $150. Also signed up for D. Very happy with Chapter. I have a major surgery in the new year. Awesome. So remember, yeah, now that you have a Medicare supplement plan, you can go to any country not any country, any doctor in the country. Your network is America. Any doctor that takes a hospital or clinic that takes Medicare takes whatever Medicare supplement plan you signed up for. There is no, pre-approvals and prior authorizations. If Medicare covers it, then you're good. That health insurance company has to cut the check for the other, 20%. So you have total freedom. Awesome. All right, let's see here. Oh, okay. I have a friend. Good, Nancy. Thank you very much for looking out for those people around you. That only has Part A and B. She gets too confused with Part C and D or Medigap. Will she be penalized without Part D, Plan D? Yes, unless she has any. If she's working and she has health insurance from work. But if not, yeah, she's going to be penalized for Part D. So if she just has Part A and Part B, then yeah, she's yeah, financially very risky, because if something happens, she's got to cover all of those gaps. So I would tell her, please tell her to reach out to someone and yeah, see if you can see if she can fill those gaps. So, is there a dental plan for Medicare? No, I mean Medicare Advantage. A lot of those have dental plans wrapped up them. There are separate dental plans. There is again exception, exception, exception. There is dental in original Medicare, but it's based on like if you have a terrible car accident and your jaw gets all messed up, um, then because they're going to reposition your jaw, they need to work on your teeth. So that dental type of dental. But what we think of normal dental, no, which I completely 100% disagree with. I think how healthy are you in retirement if you can't see, eat, or hear? I think original Medicare should have vision, dental, and hearing. But yeah, once I become dictator of the country, I will. That will be my second proclamation, right after male powder baldness solution. Maybe I'll hold off in case the VA gets gutted. Shrug. Yeah, exactly. So I would again, see if you can get one of those Medicare supplement, Part B give back, and I was denied my delayed retirement benefits because I didn't have my 40 credits until I reached 72. I'm 72. I would like to appeal. Can you help me? Um, so yeah, you cannot get delayed retirement credits if you're not even insured. So so you weren't even insured. So you didn't delay retirement. You couldn't receive retirement benefits because you weren't insured. So you can file an SSA 561, which is a request for reconsideration. But if what you're saying is accurate, then no, you did not delay. You signed up for benefits the first month you were eligible for those benefits. So nothing was delayed according to what you wrote there. So let's see. Never signed up for Medicare Part B, N, or P, or Advantage, or any Medicaid, Medicare, or other. Okay. All right. All right. Let's see here. Lisa, I'm 62 and divorced from my husband, who I was married to for 17 years. He passed away 4 years ago. Can I file for survivor benefits even though he remarried and had 4 children? Yep. No, no relevance whatsoever. If you're 62 years old, you could have filed at 60. Um, if you're currently receiving benefits on your own record, if you already started, you if those survivor benefits are more, you can add those on top of your current retirement benefits. If they're not more, then unfortunately there's not more. Um, and then what else is it? Passed away 4 years ago. And no, in terms of if a person is remarried and has children or something like that, the new spouse might receive survivor benefits and the kids might receive, but that has no relevance to your benefit amount whatsoever. So please call and start your benefits. And again, you are limited to the amount of money you can make. Next year is a 23,400, but if you're under that, then you're good. If you're over, then they're going to hold back $1 for every $2 you go over. You should totally make a Dr. Ed meter. Yeah, right? It'd be hard to calculate, lifetime benefits, but I know we've at least 20, 30, 40, 50 million or so. Um, I went to Office of Aging here in Pennsylvania, and they were extremely helpful for getting me to the places for all kinds of help. Awesome. Good deal. Yeah, I did a video about a week or so ago. It's called Living on Social Security Alone. And I went over like 50 different plans or 50 different programs and plans and resources out there that might help, you or someone you know, um, you know, live a little bit better. And I think number 50 was going to the Department of Aging in your particular neck of the woods. So awesome. Glad to hear. All right. Let's see. Blue Eyes on SSDI since age 62, have A and B. Do I have to sign up for D or automatic? Is it mandatory? Um, if you already have Part A and Part B, that means you're on SSDI for 2 years, 24 months, and then you get Part A and Part B automatically. If you don't have health insurance from work, yours or your spouse's, then it's kind of mandatory. Um, if you didn't, then you're being penalized right now. So I would definitely check something out and see if you can go ahead and get into a Medicare supplement or a Medicare Advantage that has Part D. I would definitely do that sooner rather than later. It depends on when you had to sign up for Part D, but you might be late and maybe you can only sign up for it in January or so. But yeah, definitely I would reach out to someone, Medicare insurance agent or broker that you know and trust, or reach out to Chapter and they'll help you out. But be forewarned, this is the last 4 days, 4 or 5 days of the annual enrollment period, and everybody, I think, is waiting until the last minute. And so, Chapter and every Medicare insurance agent in the country is just completely inundated. So, yeah, it's the annual meeting of the Procrastinators Club. That's usually on Valentine's, but anyway. I have $1,200 Social Security retirement, medical care deduct 175. How can I waive this 175? Yep. And just as I was talking about, call if that's all you're receiving, contact your Department of Social Services in your state, apply for Medicaid. And then if you're approved for Medicaid, call up Chapter or whoever and get a Medicare supplement dual eligible plan. If you're not eligible for that because of any type of resources you have, then try to find a Medicare Advantage Part B give back to help you pay for that. What is Chapter? Chapter is a Medicare insurance company, and they help people find Medicare supplement plans, Part D plans, Medicare Advantage plans, and those are the people my son and I look throughout the country for an organization, a company that would help and also provides after service. And they look at all the plans, and they don't charge anything. Everything they do is 100% free. So I have Medicare Part A and B. I'm also covered with my wife's health insurance from her job. Okay. Do I need a Plan N or G supplement plan? No, no. Your wife's job is probably, it fills in all the other gaps. It really depends on how good that health insurance is. But if you're happy with it and she's happy with it and it's not crazy expensive, then yeah, you might be good. But when you lose it, yeah, you're definitely going down the right aisle, considering those two particular plans. But but if you have Part B, you're paying that 185 starting next month. Um, do you need Part B because you have health insurance from your wife's current work? So you might be able to save yourself some money there. Why does SSA feel like the IRS? Yeah, it does sometimes. And it's going to get worse too, unfortunately, because right now Social Security is at a 50-year low in terms of staffing, which is terrible. That means they the help getting through and all that. It's just a nightmare. That's why I'm doing these crazy videos, and it's going to get worse. Yeah, even if they hired, even if Social Security found a gold mine, and all of a sudden they get $1 billion to hire a bunch of people. Customer service will actually get worse for a year or two because it takes about a year or two to train all those people. That's why I hate all these people on social media trying to give Social Security advice. And after a couple of days of online seminar about Social Security, and they get a cute little certificate that says I'm an expert in Social Security. It takes 2 years, 8 hours a day, 40 hours a week to learn to finally become kind of semi-independent in terms of all the details of Social Security. And so even if they hired 20,000 people tomorrow, it would take them 2 years, and then all the people in the office would have to help those people. So that's why customer service would actually get worse because yeah, they're trying to train people. Yeah, so it's yeah, something needs to be done. If I have a job, Social Security and Medicare, and my employer offers me private insurance, can I come back to Medicare if I lose my job? Yes. If you start receiving health insurance from current work, yes, absolutely. So you just have to go down there and refuse it, and then later on you go back there and show that yes, you did have health insurance. All right, divorced, 29 years of marriage, not enough working credits, not working at 62 on SSI, disabled plus Medicaid. Am I eligible for Medicare? Um, not enough working credits, not working. So yeah, if you're just on SSI, then no, because there is no Medicare from SSI, because SSI is a supplemental security income, welfare-based program. So you did not pay into Medicare, but maybe because you're eligible for Medicare or for disability based on two different insurance statuses. So maybe you were on one but on another, or what if there's a spouse? Were you married to anybody? Maybe you could get Medicare based on that particular person. So, but you're at 62 as well, so you'd have to be 65 for that. Um, well, you're 62, you'd be entitled to spouse benefits, but yeah, your Medicare would start at regular 65 because it's not based on a disability status. So, I have a son who was getting SSI and is now receiving SSDI because of DAC, disabled adult child. We realize it takes 24 months to him qualify for Medicare. His bank account gets hit with a large sum from Social Security. Gets hit with a large sum from Social Security. Yeah, I'm not sure what that means. Um, Possibly. What happened is they approved him for disabled adult child, SSDI, and 24 months of being on SSDI, you get Medicare. They sign you up for Medicare automatically. So perhaps they just approved it, but they backdated it 2 years. And then because they backdated it 2 years, guess what? Now you owe Medicare. So maybe the money they took out of your Social Security, the account there, the deposit was for Medicare for however many months or so. But you said it was a large sum. So the only other thing is, did you use a lawyer? Lawyers are allowed to charge 25% or next year $9,200 to help you. So we don't want to lose Medicaid. Can his Social Security check be deposited in my account instead of his to avoid going over any amount that could jeopardize his Medicaid enrollment? Um, So yeah, you're looking at resource type thing. But I would definitely, so yeah, so he's receiving Social Security check, and that Social Security check does not put him over the income limits for Medicaid. But it sounds like you want to save that money for something. You're not necessarily using it. And then if you're like, check out an ABLE account, ABLE. They just changed the criteria, the regulations on that, and yeah, check to see if that's right. So an ABLE account, say if you're on a welfare based program, SSI or a Medicaid or whatever the case may be, and those have resource limits. But you're like, well, for example, if you have someone in a wheelchair, it's like, want to buy a new wheelchair or a wheelchair accessible van or something like that. And we're going to take a little bit of money out of this person's monthly account, the Social Security benefit, and put it in a bank to save the $10,000 we need for whatever. But as soon as you go over, $2 or $3,000, then they shut it off. So it's like, oh my gosh, it's crazy. But if you set it up in this ABLE account, then you can use that money specifically for that reason, and it's not kind of the purview of the welfare-based program. So I would definitely check that out. All right, I got way too many questions as usual. I apologize. We're out of time today. Um, I'm going to be back again tomorrow, and I'll get a bunch of questions again tomorrow. So if I didn't get your questions today, please cut and paste it. Join me tomorrow, but don't paste it in there before I start. Do it when I start, because the questions that you paste before I start, I don't see. So all right, y'all have an awesome day. Take care of each other, and we'll see you next time. Bye bye.